This month's Lunch and Learn with the National Bone Marrow Transplant Link will cover the latest on chronic GVHD, trials, research, and what's on the horizon. Our guests will be Dr. Farid Farr, a nationally recognized expert in the field. Additionally, survivor Steve Hodges will provide his best tips and tricks. This month's Lunch and Learn with the Link will be Wednesday, February 19th at noon Eastern. Sign up for free by visiting nbmtlink.org or just follow the link in our show notes. Welcome to Season 16 of Marrow Masters, sponsored by Sanofi. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow transplant, from diagnosis through survivorship. Season 16 of our show will focus on the best tips for dealing with chronic graft-versus-host disease. Top-notch healthcare professionals will share their compassion, best advice, insight, and caregiving tips regarding chronic GVHD. This season will offer education, tried-and-true solutions, stories of hope, and more. Now, here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. So today we have with us Carly Cappozzo, a senior occupational therapist at a major cancer center in Texas. So Carly is an innovative clinician with a passion for customized patient care. She focuses on the whole person, empowering patients to be active participants and leaders in their own recovery journey. We love this. Carly developed the hospital's first chronic graft-versus-host disease rehabilitation program and is an expert in chronic GVHD rehabilitation, advanced splinting, and serial bivalve casting. Phew! For 9 years, Carly has been part of a multidisciplinary team, collaborating weekly to treat GVHD patients from all around the world. Wow. Hi, Carly.
Hi, Peggy. Thank you so much for having me today.
It's our pleasure. We're going to talk about GVHD a lot, but first, will you please share with us the details about your role as an occupational therapist?
Yeah, I would love to. Occupational therapy is part of the rehabilitation team, and our role is to help you be able to do anything that occupies your time as independently, safely, and in a way that is as rewarding as possible for you. So that's everything from the basics, like getting yourself dressed, taking a shower, to things that you want to do and give your life meaning, whether it's a role you play in your family as a spouse or a parent or any leisure activities you enjoy. Our goal is to help you be able to do those things as easily and safely as possible. So through that, we use something we call activity analysis. This is basically the lens that we look at everything through. And it's kind of breaking down a task to determine all of the different demands of an activity. So, for example, the different objects or tools that you use, the space or environment you're doing it in, the skills that you need, the physical skills, cognitive skills, the energy demands, the time of day and frequency you're doing these things. And once you understand all of the different component parts of the activity, you can figure out how to adjust those to combat any sticking points.
Well, that is very interesting. I'm so glad you explained that. So what might a typical occupational therapy treatment session look like, Carly?
So it completely depends on the person and what they need and what their goals are. So my ultimate goal is to teach patients to be the captain of their own health and wellness ship. So we're constantly adding tools to their toolkit. This could look completely different depending on what they need, but for example, if they have skin tightness and limitations from graft-versus-host disease, we might be doing manual therapy and stretches, teaching them what stretches to do at home, working on diaphragmatic breathing and relaxing during the stretches. And while we're doing that, talking through some of their daily routines. What are their aims for the week based on what their goals are? And then practicing the activities that they want to be able to do. So in our clinic, we have a kitchen, we have laundry facilities, we have a garden, we have woodworking. So we can actually have the patients practicing the activity they want to be able to do while we're cueing them and educating on some different adaptation strategies or ways to make it a little bit easier.
Wow, that's so hands-on. I really love that. That's got to be very comforting to patients to have that very intimate experience and feeling, I would imagine, just really empowered by it.
Yeah, I think patients kind of lose their identities that they had prior to transplant, just with all of the stress and time commitments and changes that happen throughout that process, and then the opportunity to get back to things that make them feel like them is just so important.
Oh, isn't that true? Just the joy, bringing the joy back, if it's gardening or whatever it is that they love to do. It makes me think of a wonderful couple that I knew that the wife was the survivor, or I should say the wife is the survivor, and she loved gardening. So her husband talked the doctor into letting her double glove and get out there and at least garden, 10, 15 minutes a day. And it was a win-win. She still got to do what she loved. It was monitored. So everyone was happy.
Yes, that sounds like something that could have come at the hands of an occupational therapist for sure. We're definitely trying to figure out ways to modify anything we can to make it accessible and do things that you love.
So Carly, let's talk about the relationship between the skin, the fascia, the muscle tightness, and the nervous system arousal and stress levels.
So something that we know is that the fascial system, which is often affected by musculoskeletal GVHD, is really related to the nervous system. And if one of them is tight and in a state of arousal, so is the other. And the key to achieving an effective stretch and improving the range of motion and decreasing the tightness symptoms that are associated with GVHD is doing a low-load, prolonged stretch that is pain-free and gentle, allowing the person to really relax into the positions.
Okay.
And that's difficult to do when you're stressed. You can't really relax.
That's so true.
So it's really important to work on strategies to calm the nervous system.
Very good. Well, thank you. So Carly, we so often hear about how tired patients are. And we all know in our own lives, how do you want to do anything when you're so exhausted? But it's a different fatigue, isn't it? Let's talk about that some more.
Yes, absolutely. That is something that we hear all the time and is one of the symptoms that really impacts patients going through stem cell transplant and GVHD quite a lot. So there are many different reasons that contribute to having fatigue after your oncology journey. And there's a difference between regular fatigue and cancer-related fatigue. And one of the ways that we describe this to patients is regular fatigue is the kind where you're doing something, you're very active with your body or your mind, you rest and you feel better. Cancer-related fatigue is not like that. You can rest as much as you want. It's not going to get better. So we can't treat it like normal fatigue. We have to treat it differently. So it's like your bank account went from $1 million to $1,000. It's just smaller and it doesn't respond to rest. So some of the ways that we help patients combat this is focusing on both energy conservation principles and also using the energy for the things that are most important to you. Because whenever you're doing things that you enjoy, it boosts your energy. So rather than spending your entire $1,000 in your energy bank account just on getting dressed and taking a shower and cooking a meal, how can we start the day with focusing on where you want to spend the energy? So my priority today is I really want to go for a walk with my grandson. Great. Let's plan the day so that that is the focus of it. And then focus on conserving energy with the other things that we have to do or getting assistance with them, either by adapting the way you're doing the activity, asking for help, using equipment if necessary, so that you can fill your cup.
Boy, that's a great way to look at things. Let's do the fun stuff first, and then we'll figure out the rest, right?
Yeah.
Recharge the battery, really, essentially.
Absolutely.
Oh, thank you. So, Carly, do you have any tips for ocular GVHD?
Yes, this is one that I feel like is not addressed as frequently as some of the other symptoms, but there's so many different ways that you can adapt to the symptoms that are so troublesome with ocular GVHD, the dryness and the grittiness and the pain and discomfort. It really impacts everything that you need to do. And especially in this day and age with so much technology usage, sometimes even navigating a phone and computer are the most challenging aspects of day-to-day life. So there's tons of different ways to use the accessibility features in the phone and computer. So there's even changing the color contrast on the phone, increasing text size, using an integrated screen reader. There's a speech controller button that you can add to your phone. There's also apps, like there's one in particular called the Seeing AI. It's a low vision phone app, and it will read text for you. It'll identify scenes that you're looking at, colors, people, the denomination on different currency. And the computer, there's different settings where you can magnify text, you can make your cursor larger. There are things that sound very intuitive or like, oh yeah, of course you would do that. But we don't think of doing those things because they're habits. It's just a normal part of your day-to-day routine. So sometimes working with an occupational therapist or someone who specializes and sees these things frequently can help you to problem solve, okay, what is it that I need in order to do this, and problem solve how we can overcome any of the barriers and challenges.
And I'm guessing many of your patient survivors can just ask their children or their grandchildren to help them with all of these features on their phone if they can't figure it out.
Probably. Yes, absolutely. Absolutely.
And you know what? That becomes a shared activity. I know that my mom is always asking my boys, will you help me do this on my phone? It makes them feel good and it makes her feel good. So that's not the worst thing in the world to ask for some help.
Yeah.
And what a great thing to bring up, because we don't want to admit it, but these phones are such a big part of our lives. So if you can't beat them, join them. We might as well figure out how to make them work the best for us at whatever age and whatever our limitations are.
Yeah.
So Carly, let's talk about lifestyle post-transplant as it relates to movement, because that is your area of expertise.
Yes. When it comes to the recommendation, there's so much research that studies so many different things, and I do not have all of those facts and figures to give you today, but what I can tell you from my experience working with patients for the last 9 years with GVHD, what works best for you, your body knows. Gentle, active movement, not pushing yourself too hard, doing what feels good, pushing yourself to the point of pain, trying to do like, I just really need to stretch into this position. And if it's the last thing that I do, it's not going to stretch you out because your nervous system is so heightened. So sometimes it's just relaxing into certain positions, paying attention to what are the things that I'm doing on a day-to-day basis and how can I get more natural movement? Are you sitting at a computer, which many of us are doing, or sitting in a chair watching television, or sitting? Bodies aren't meant to do that. It's just part of the lifestyle changes of wellness.
What you mean by that, to keep moving, stand up, move around, then sit down again, that kind of thing.
Yes, exactly. And listening, like I said, to your body and what it needs. You're the driver of your health and wellness. It's easy to look to all of the other members of your team like, what am I supposed to do for this? What am I supposed to do for this? What am I supposed to do for this? And you should go to them with your symptoms and say, this is what I've been noticing. These are some patterns I've been noticing. Is there anything there that stands out to you that I should be doing differently?
Okay.
And getting another set of eyes to look at it. But when it comes to the day-to-day life, you're the expert on that. You know what you're doing.
Exactly. I mean, someone that has run or walked their whole lives, they're still going to want to do that. But you can't take someone that maybe has been super sedentary and then expect them to be a marathon runner after that.
Exactly. So while exercise, quote unquote, is important, movement is really what is the most important. That could look like exercise. It could look like yoga. It could look like weightlifting, but it could also look like lifting up your grandkid.
Yeah.
Or carrying a suitcase to go on a world travel that you want to go on.
What a great way to look at it. I like that a lot. So Carly, can you tell us more about ways to maximize engagement in the meaningful occupations and maintain a level of independence despite any physical limitations?
Yes, this is something that we focus on a lot in occupational therapy. So we know that engaging in activities, engaging in the roles and routines that are most important to you is what maximizes your health and well-being. It's important to do those activities. First, identify what they are, but then to do them regularly. So if it's really important to you to fulfill your role as a mother, for example, what aspects of that do you want to be able to do? Is it important to you to meet the physical needs of your children? Do you want to be the one who's doing the caring for them, changing diapers, or giving them a ride to and from a place? Or is it important to you to be the one listening to them talk about their day at school? What parts of your day-to-day routines help you feel well? And that's going to look different for everyone, but there's ways to modify if there are physical limitations that are getting in the way in order to do the parts that are most important to you.
I love this. I really never thought of it that way. It's really about what fills your cup so that you can go on to be a good mom, and having the ability to reach out to your other loved ones and let them fill in where maybe you can't do that for a certain amount of time, but then what you really want to focus on still gets done.
Absolutely.
I like that a lot, Carly. So do you have some experiences you can share where you have seen the results of time, patience, consistency, and the resilience to just keep on keeping on post-transplant?
Yes, I have definitely seen this firsthand. It is a long process, and your team is going to be working with you to slowly taper all your medications, and slowly but surely you learn what works for you, what works for your body, keeps you feeling flexible, strong, healthy. But I've had so many patients that started occupational therapy needing casts or splints to help stretch out really severe contractures and progress to being discharged from the GVHD clinic completely off of all their medications and back to leading fulfilling lives, doing what is important to them and having minimal residual limitations.
Oh, that's good stuff. And we know that GVHD is definitely a marathon sometimes and not a sprint. So, realizing that this could be a long haul, but baby steps, and you'll get there.
Yeah, absolutely.
And the important caregiver. So I want to ask you about that. We focus so much on the survivor, and of course we should, but any pearls of wisdom, any advice for the dedicated GVHD caregivers?
Yes, of course. I would say the number one recommendation I would have for caregivers is self-care. It's so, so important, both for your own health, because being a caregiver is so hard and so physically and emotionally taxing. So caring for what your body needs is important for you, but also you're modeling this for the person that you love and care for the patient. And being on that journey together of, these are the things that I need today to take care of myself. What are the things that you need? So communicating that back and forth between one another. The other thing I see often is that the best caregivers in the world sometimes are the ones that get scolded in OT the most because they're doing too much for the patient. And not that they don't need or benefit or want some assistance with things, but sometimes there's things that you're doing for them that really would give them a sense of fulfillment and purpose to do themselves. Like, think about how rewarding it is, difficult, but rewarding it is to be a caregiver, because you're able to give the time and energy of yourself for the benefit of another person. Now imagine the role is reversed and you're in the patient's role, just taking and taking and taking all the time. It can be challenging.
Sure.
They want to be able to feel like they're giving back or doing something they enjoy also. So communicating back and forth and understanding, oh, I can see why you would want to help with the cooking. Not worrying so much about, oh, you can't get in the kitchen, you're going to fall, you're going to cut yourself, you don't have to do that, I'll do that. No, have a conversation about, okay, I hear you that you want to help with the cooking tonight. How can we make that happen in a way that meets both your needs and mine? I'm concerned about you falling, so why don't we put a chair in the kitchen? We'll pull it right up to the stove. You can sit and you can do all of the cooking. Would you prefer that I'm in the kitchen with you? or out of the kitchen? How involved do you want me to be?
Oh, I like that a lot.
Kind of, negotiating how you're going to adapt it to meet everyone's needs.
There's a story that some of our listeners might be rolling their eyes because I tell it quite often, but we had gotten wind of a couple where the wife loved to make pies, and then she was sick and she was struggling trying to make some pies for a family occasion. And the sweet husband said, why don't we do it together? That way I can spend time with you. You could do half as much instead of trying to do this all by yourself. And it became an activity that they did together. They made pies together. So I think it's exactly what you're saying. Find a way to make it work so that everyone's happy.
Yes, I love that so much. I think that's just a perfect example of what I imagine occupational therapy to help people to figure out a way to do. That is frequently what we're doing during our therapy sessions.
Well, you do such special work. Wow, your patients are so lucky. So, Carly, as we wrap things up today, is there a story of a survivor that you could share anonymously that really shows the power of occupational therapy and what it's capable of doing for people and why it's so important to keep this in mind?
Yes, I have two stories that I can think of that highlight two different aspects of occupational therapy and our role in these patients' care. One is a younger patient in high school who had quite severe contractures related to fascia and skin GVHD. And when we started therapy, there was a lot of physical biomechanical approaches to his rehab. So we were making custom serial bivalve casts that he was wearing that put him in a stretch into wrist and finger extension that he would wear at nighttime while sleeping. And then as he progressed with that, we would make new casts that had more of a stretch until we were able to get the range of motion that we needed. At the same time, while we're doing that, we're talking about, okay, what do you think going back to school is going to be like? What concerns do you have? What story would you tell people if they came up to you and said, hey, what happened to you? Why do you have that scar? You get to control the story. You can say as much or as little as you want. So we kind of talked through and role-played some of those scenarios. We talked about, okay, you're going to need to carry your backpack when you're going around school. So we would practice walking through the hospital, carrying progressively increased weight in the backpack. We addressed mobility quite a lot. He had avascular necrosis in his hips and pain. At one point was using a wheelchair primarily for mobility because the pain was so severe. Progressed to getting hip replacements and then rehabilitating from that. So our plans changed throughout the whole course of therapy. But by the time he was discharged, he was walking full time with no assistive device. He went back to school.
Great.
He made friends, got involved in theater, and went on to going to college and getting a job.
That's wonderful.
The other example that I was going to share is an individual who had similarly quite severe range of motion contractures and had really put in so much time and effort and dedication to doing stretches regularly, doing my exercises regularly, and was just getting so worn out from constantly having to focus on these things. And I said, what if we scale back how often you're doing the stretches? Don't set an alarm for it. Don't revolve your whole life around it. Let's focus on making things a little easier, adapting the way that you're doing stuff. We got a scooter so that when he went out with his family and daughter, they could go longer distances without needing to stop and rest. Just little things like that that make everyday life easier. Long-handled equipment to help put on pants. A sock donner to help put on compression stockings easier and independently. Picking things up from the ground with a reacher. Make day-to-day life easier. So despite having these range of motion limitations and tightness, we found ways that he could get back to doing things that he wanted to do. Cooking a really delicious salsa that was his specialty for the family again. modifying the way that he was doing it. So despite not getting back to 100% range of motion, he would have described his quality of life as very good.
Awesome.
So there's two very different outcomes physically, perhaps, but both result in amazing quality of life.
Great examples, Carly. It just shows there's so many ways to approach this. And eventually, a lot of our patients and survivors, they get back to pretty close to where they were. It just takes time. And with GVHD, we know that you have to be patient. So thank you so much today for sharing your wisdom and your compassion and your just great strategies, great ideas for getting there. So thank you so much.
Absolutely. It's my pleasure.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.